Hello, everyone. It's really a pleasure to be here with you in the eHealth Summit 2021, a really special eHealth Summit because it's also part of the Portuguese presidency of the EU this year. And I'm really proud to be here hosting and moderating this table on the future of global health with a number of renowned speakers, panelists, members of this panel that I would like to introduce in order of the appearance in this session. The first who's going to take the floor will be Silvia Piai, and Silvia Piai is the research director at IDC, and she's also a lecturer in digital health in the IMC University of Applied Sciences in Krems, and she's been with the IDC since 10 years, so indeed an expert with a vision on health insights in Europe, and not only Europe, globally too. The second to take the floor today with us will be Dipak Kalra. Unfortunately, he's not live in the panel, but he left a video recording with a statement. Dipak is the president of the European Institute for Innovation through Health Data, and is also a professor on many other universities. The third to take the floor will be Professor Rajendra Gupta. Professor Rajendra is a renowned book author and policymaker. He was former advisor of Ministry of Healthcare in India, and is also a chair in the WHO and a number of other initiatives that he embraces and champions, besides being the author of a recent book on digital health that I've had the pleasure to do a preface. And it's really great to have Professor Rajendra here with us today. And last but not least, we have Stefan Buttigieg, which is, I hope that I didn't misspell your name, Stefan, medical doctor and the co-founder of Digital Health Malta. And Stefan is also the vice president of the Digital Health section in the European Federation of Public Health. So it's really great to have such a relevant panel for what brings us here. Without further ado, Silvia, the floor is now yours.
Okay, thank you very much, Paul, and it's a pleasure being here with you today. Just to state what we are doing at IDC, we are looking at the key market trends around the use of digital across many different industries. I'm in charge of the European research for healthcare. And in our research, basically what is telling us that we have seen, of course, an incredible acceleration on the use of digital tools across Europe. And now that hopefully with the vaccination program in place, we are going to see an easier situation to manage. We see that, however, the healthcare organizations are not losing momentum on their digital investments. And while there is a significant part of them that is very much still focused on business continuity and ensuring resources sustainability, the large majority of them are taking stock of the experience of the pandemic and starting to invest in a much more targeted way, and especially in those areas that has been highlighted as gap during the pandemic in their digital infrastructure. And they are really focusing on creating a new layer of resilience, which is going to help them also in the next normal, so to say, as we know that the level of uncertainty will be still high due to the fact that this probably won't be the last crisis for our healthcare system, but also because we can expect a new level of services demand due to the economic crisis and to the social crisis as well that could be one of the results of the pandemic. And we know that this has direct implication in terms of the demand of healthcare services. So at IDC, we see three main areas where the investments are focusing. One is the patient services innovation, where we see the emergence of a much more integrated and automated digital front door for the patients that try to create a sort of an end-to-end experience and integrate with both the virtual and the in-person one in order to increase the choice, the convenience, the control of patient, and also their engagement. The second area is the empowerment of the clinical workforce, which is about really ensuring that the healthcare professional has access to the right information at the right time and embed this information into the workflow so that they can take much more evidence-based decision. And the third one is about greater process automation, looking at the operational aspects and the efficiency in order to avoid the disruption and to allow the workforce to focus on the much more value-added activities. In all these three areas, we see a huge role for advanced tools in AI, artificial intelligence, and that really can make an impact on on the automation and on the support of the decision of each of the stakeholders here involved. And really, all these technologies need to rely on what we at IDC we call a new health paradigm. We call it a patient of one scenario, where we have a complete view of the patient, a complete view of the population, that allow to provide healthcare with a stronger precision, with a stronger personalization, so tailoring treatments around specific needs, but at the same time, they allow to integrate and orchestrate the different services and the different organization on the patient journey. So the patient of one is asking for a new way or a new approach to information governance and to information management. We need healthcare data not only to be more secure, of course, because we are dealing with very sensitive information, but also we need to integrate the various sources. We need to go a bit more granular sometimes, and we need to be much more with a real-time access to information. But most importantly, we need to deliver data in a way that is relevant to the context in which it's going to be used. Otherwise, we risk the sort of information overload. So this kind of new paradigm will allow us to finally move from what we call a system of record, which is what is mostly about up to now, to a system of insights, and to use these insights to create engagement, both with patient, but also with the workforce. And we have witnessed many best practices during the pandemics, and also today, we see that the organizations that are succeeding in turning data into a system of insights and engagement do follow a framework that is built upon the organization capacity to learn from the information, combined with its ability to synthesize the information and to apply the insights at scale throughout the different workflow. Also today, in the deployment of the vaccination strategy, intelligence defines the capability to drive innovation, productivity, and patient value. In the UK, for example, using the Q-COVID analytics model that has been developed by the University of Oxford, NHS Digital was able to prioritize around 800,000 people aged between 19 and 79 that were at greater risk from coronavirus than previously known, and that now have been prioritized for immunization. And this approach to data has allowed to prioritize the most vulnerable segment of the population by putting together data that were telling us about not only about their healthcare condition, but also about some social factors. They were able to identify those populations that were much more at risk, and making the vaccination program much more efficient and more effective. This is what is meant to be a data-driven organization, not only a data-rich organization that we know healthcare is probably drowning in data, but making sense of those data and to make an impact, it's actually the challenge that we have ahead. The strategy toward an intelligent healthcare enterprise and intelligent healthcare organization requires healthcare information to focus, require healthcare information to be focused on enabling the capabilities for sensing and predicting healthcare phenomena. And we see that European healthcare providers have been prioritizing some of the data optimization programs to increase the quality of their information. But the value of information, as I said before, lies in the action it enables, and healthcare organizations really need to increase the level of automation to dynamically allocate all the resources to responding to the changing healthcare condition through intelligent health system that serves both the patient but also the workforce. I'm particularly adamant on the healthcare workforce because they need to be empowered, they need to be augmented because the stress over them, especially during the last month, but this was a kind of a everlasting phenomena, is particularly important and has an effect on the efficiency and the efficacy of all the intervention that we have. We know that we still have to address some of the health data dilemma. Today, many organizations, around 40% of us, those that we have surveyed, are still telling us that the key barrier to drive business value for them is the inability to access data in an efficient way. And we know that this is down to inconsistent data collection processes, lack of interoperability, fragmentation of the data types, the difficulty to integrate the different legacy system. So we recommend at IDC a sort of a new company-wide data management strategy that breaks down all the data silos, a strategy that looks at the whole data cycle and from how the information is created, stored, around the health data interoperability, how interoperability and integration is implemented, to the really strategic definition of the use cases that will so identify where you're going to use the data and how, what kind of processes you want to automate, what kind of a decision you want to support. And then by working with the stakeholders, with the professional, with the patients that actually are going to use this data, define this tool. This data management strategy is what makes the patient of one vision that I've described before coming really to life and foster a culture of intelligence in healthcare. And hopefully, but actually some of the evidence is already telling us, the results are increased patient value that is delivered through better and personalized services, but also through a better integration of the services. The experience across the journey is much more continuous without too many interaction. Hope this kind of helps set the scene. I really share some data point, but really looking forward for the discussion later on.
Thank you so much, Silvia. This was very, very insightful observations, and I have already taken my notes here for a couple of questions that I would like to pose you, not only to you, but also to our guest speakers. So the second intervention will be from Dipak Kalra. It's a video intervention, as Dipak is not able to join us today live, but he was so kind to record a statement on his vision for the future of health data. So let's hear.
Hello, I'm Dipak Kalra, President of the European Institute for Innovation Through Health Data. I'm sorry I can't be with you today in person, but I'd like to convince you that there is now an urgent need to scale up our collective capability to learn from health data. We need to better apply the information in everybody's electronic health record to make clinical decision-making smarter and the patient experience of healthcare more personalized and effective. Healthcare systems need to learn more extensively from the EHRs of their populations to better respond to health needs to make sure that they are achieving the best outcomes through the health and care services they provide, and to protect the public's health, which we now realize is so critically important for all of us. Public health strategies and monitoring must be better underpinned by real-time evidence. And we must accelerate research, such as the development of drugs, vaccines, and AI algorithms, through being able to analyze data at a big enough scale, certainly at a European scale. Europe is investing within and across countries in research infrastructures to enable this scaling up, most frequently through using federated architectures. The latest development is the plan from the European Commission to create a European health data space, which is exciting. However, any architecture to combine data or to run distributed queries is critically dependent upon the data being in a standardized form, structurally and semantically. Standards exist to achieve this, although more stakeholder engagement is needed in defining useful clinical models. But the real adoption of interoperability is disappointing, and it needs further incentivization and investment. But how can we best achieve this when our efforts for wide adoption of standards up to now have been painfully slow? How can we change the pace, and who are the change agents to drive this? Data quality is another concern that can only be improved if there is awareness that this is important and a recognition that many stakeholders need to become motivated to improve quality. We must especially help health professionals to capture better data at source. And let's not forget patients and their data, which is of increasing importance to all of us. In other words, we have to care more about our health data. It's precious. Scaling up the uses of data also means engaging new actors, such as industry, in a partnership model, working with healthcare to co-develop the next generation of innovations. We have to make sure we develop and embed best practices in data protection and information security so that everybody has confidence about these essential uses of health data. Transparency is a critical success factor for that trust. Data access governance rules must be developed through public open consultation. The bodies who make access decisions must publish information about the data accesses they have permitted. For the public to be on board, they have to understand much more than most people do today about the nature of health data, how it can be used for the benefit of society, and what safeguards protect them when their data is used. How can we best engage the public when making data access decisions on their behalf? I'd love to hear about how you've discussed these issues. Thanks.
And certainly some questions that are already on the table. And as agreed, Professor Rajendra, the floor is now all yours.
Thank you, Paulo. And you do a phenomenal work of connecting people, getting the right topics. And it couldn't have been a better time than now to talk about data. I'm really fortunate to be part of the future of global health as a part of the eHealth Summit. And I recently authored this book that you see and have covered this in detail. So I'm going to flip the conversation on the clinical aspects of how data is transforming. And what I'm going to do is walk you through how I have seen data evolving for the last 6-7 years. An article I wrote in 2015, which is 6 years ago, on software as a drug. So that time people asked me, what are you talking about? I said, that's it. That is data. Now data is used as a drug. 5 years later, this is what I wrote. And this is my understanding of using data. Now look at this interesting perspective. When you use your EHR, data becomes your identity. When you look at putting AI on your radiology images, CT scan, data starts diagnosis. Data is diagnosis. Data is your health coach based on my readings that are captured through my mobile device, based on various biographical data that you capture, you can actually be a health coach. The chatbots in the UK are much better when compared to clinicians. That's what the research is talking about. That's what I ended up mentioning in the book. Now, data is also a drug. You'll be surprised when I say this, but that's what the US FDA does when they approve mobile apps to be reimbursed like a drug. You can actually use data to titrate your insulin dosage. You can use gaming to treat ADHD. Could you have imagined? Because WHO's ICD-11 said gaming is a mental health disorder. Now we're using gaming. 3 years later, we were using gaming to treat ADHD. And this is all about data. So data also becomes your treatment. Now we talk about a whole lot of things of data. This is how I have seen data. It's changing. And the way it's changing, Paulo, I can tell you, I mean, with such luminaries as my panelists, Silvia, Stefan, and Dipak, that I will not be surprised. What I call as digital therapeutics, a digital therapeutics company may actually end up acquiring a conventional pharmaceutical company, because they would be valued much more than the conventional therapeutic companies. But I have a caveat here. I think people like you, Paulo, have enormous influence when you host these summits, watched by millions. So my next slide is important. This is what I again wrote a few months later after I wrote that article. They were daydreaming about AI and automation without EHRs. We need to ensure that if we are going to talk about big data, first we need to talk about basic data. The basic data is not available in the way it should be. The adoption of EHRs is still not high. We need to make sure that we have a movement. And Paulo, I think maybe at a later stage we should talk about how do we do this as a movement. And I think your forums have become very impactful over the last few years. So this is something that I would encourage people, across the world on looking how do we increase and boost the adoption of EHRs. Because for me, data is much more than just what you call as oil. For me, it's a renewable resource. I think that's what I would call it as. And with this, I thank you for giving me an opportunity to talk about this. But my vision of data is going to be this, what I mentioned in the book. So if you are a clinician, so this is what I had written. Ethics will be replaced by algorithms. Clinical skills will be replaced by commands and programs, and experience will be replaced by repositories. Instead of clinician deciding about the line of treatment or a second opinion, it will be an intelligent system. Prescription will include social media behavior in the patient notes, and an app will be prescribed like a drug. Welcome to the world of digital health. So this is what my vision is on digital health, and thank you so much for the opportunity.
That you can actually include the social behavior of a patient on the treatment strategy recommendation. That's a really powerful thought, food for thought in our debate. So last but of course not least, Stefan, the floor is now yours.
Hi, thanks everyone. I'll quickly just share my presentation. And first of all, today I'd like to talk to you about digital public health. And when you think about digital public health, you think about a couple of things. But I just want to give you some of my background a bit. I'm wearing a couple of hats. That's why I couldn't resist putting a hat here. I'm working in a number of organizations, including EUPHA, including Digital Health Malta, and I'm also working within the Ministry for Health. And today I come to you with all these different perspectives in mind. And I invite you today to reach out to me on social media. So we just mentioned social media. So we'll see maybe one day this social media behavior will end up on an EHR. That will be quite interesting. And we really need to talk about digital public health, not just being as digital public health, but simply public health. And when you think of digital public health or digital health, do we just think of it as digital or technology? No, it's more than that. It's a social science. It's about problem solving. It's about change management. It's about effective communication. And it's also about influence and even bigger picture thinking. this is beyond just the technology. And really and truly, we need to start looking at a paradigm shift. So, as I said before, digital public health, but rather public health. And I feel inspired by PwC's 8 disruptive technologies. And they outlined these 8 different technologies, which in many different ways could definitely form part of this global public health, and could also create the relevant data to empower even our present and even future public health response. So quite a lot happening there. And we need to start looking in order to understand as well how our data flows and how our data moves. We really need to understand the digital health ecosystem. And the digital health ecosystem, even chiming in also from my previous esteemed speakers pointed out, also looking into gamification, for example, big data and artificial intelligence. But sometimes, if we don't have all of these factors in place, and if we don't have a good understanding of what's happening, something as simple as having EHRs and having them available, because without EHR, you can't really have data. And all of this needs to be developed within an equal partnership between the different stakeholders, including patients, including healthcare professionals, and also managers and administration, bringing all of this together. Now, the COVID-19 pandemic has been a definite accelerator in this, and really and truly, the biggest wins were in mobile apps. Imagine apps usually needing years to develop, have been developed in a period of 6 months. Just have a look at contact tracing apps. We're looking at data science and data flows. Imagine before, you wouldn't even imagine that the government would put out an open data set on GitHub. Now it's common occurrence. Even looking at digitalization, communication and operation change, even something as simple as getting all those people on virtual meetings. Whereas before it used to be seen as a luxury, now we have it there, it's obvious. And even from that, you can even bring out the data to start building a business case finally, because before it was so much more difficult to build that. And with all of this, we've also seen shifts in the business processes, in the human resources and the digital infrastructure. So because of this, we have this really positive cycle. And just to show, here we have all these different communication tools that were being used by the different providers. And I'd like to take into consideration the example of Malta. For example, Malta, in the past year, in the COVID-19 pandemic, in a short period of time, we've set up a whole new telemedicine center. So from a few couple of hundreds of telemedicine calls, now we're at hundreds of thousands of calls and virtual episodes, a significant change. We also set up our national contact tracing app, and we even got it featured on the European list of contact tracing apps, and now it's also interoperable, a massive shift. Data moving, data flowing, even privately, not necessarily identifiable data. So this is like a necessary shift that was brought about. And data being available and visualized so beautifully in a way that anyone understands. Anyone understands a big dot or a small dot. These are all intensive shifts that have happened, and they were only possible through data and the flow of data in an easy and accessible way. Even this, for example, the GitHub repository, like having it here available in a raw format, in a CSV format, which you can easily pull out. Monumental shift happening there. Even, for example, having a look at, for example, the coronavirus dashboard for the Netherlands. Even the way the information is visualized and communicated. So not just data flowing, but data being communicated. Significant shift happening there in a way that everyone understands. For example, one person is vaccinated every so much time. And even the World Health Organization took a massive shift and decided to invest in this, and even put out an outbreak management system available for so many countries, enabling digital global public health, digital health, all of this, enabling the flow of data, building APIs. So the shift is happening. And just to show you, even we in Malta, for example, we also saw a significant shift in the uptake of digital interventions, such as registering for a vaccine. And this has enabled the delivery of information, delivery of data in a fast and accessible way. Thousands of people use this platform. And now we're seeing a shift even in the way data is standardized and data is flowing to the digital green certificates. There's a lot of push now for not simply data dumps happening from one place to another and moving around, but using APIs and free-flowing information that updates, making the experience seamless for the citizen, for the patient. We're seeing examples of this green certificate through the IATA Travel Pass. We're seeing Microsoft investing heavily in healthcare. And these are just the two screenshots from our Dynamics 365 platform that we have even in Malta, and the Power Platform. So data is truly everywhere. And before, when I originally prepared this presentation, I was even looking before the COVID-19 pandemic. And you can see that there is a lot already happening with data and digital public health and making it work. So this is beyond even COVID. But how are we being guided? And one of the biggest things that I've seen, that first there were the first two guidelines by WHO on digital interventions and classification. Now we even have WHO releasing a document on digital information infrastructure, infrastructure for health, a massive development there. And even the European public health, focusing on public health futures in a changing world. So really, truly, what is the potential? We're looking at multidisciplinary things, bigger picture thinking, augmented reality public health dashboards, improved intersectoral collaboration workforce, and much, much more, just through the effective use of technology and behavioral change. So how do we get there? I would recommend the SPICE path. It's easy to remember, SPICE. And we really need to look at 5 main things: supportive digital health ecosystems, clear procurement pathways, an innovation framework, behavior change, making it the core of the whole delivery of digital public health, and intensive education and awareness. You can make a difference. One course at a time, one talk conversation at a time, one social media page profile at a time, one website at a time, one business intelligence dashboard at a time, even an app or a new Wi-Fi network, just enabling workspace and the flow of data in your organization by enabling network. And always be ready to jump at the right time. We have to be at the table and not just on the menu. Obrigado.
Thank you so much, Stefan, for the insightful presentation. And I think now we have enough background to make a little bit connection and to establish a little bit of a conversation here. I noticed that there is an interesting starting ground from IDC's vision of the patient one scenario, right? And the approach that is proposed by you, Stefan, I don't see where is the bridge really, because on the other hand, you talk about a number of steps, right? But I think in your slide there lacks the vision that probably Silvia proposes, the patient one vision. Who wants to jump here on the comment?
Maybe Silvia, that would be great to hear from you.
No, absolutely. I think it's, the patient of one vision is kind of the groundwork for then what is the work around public health. Patient of vision is working at single patient point, from a single patient point of view. But clearly, when you have this vision that is interoperable, that is real time, that is dynamic, that takes into consideration also some of the social determinants of health as well, not just the data that are produced within the, let's say, narrow healthcare system, you can then go up on a level of abstraction and looking at population and looking at a particular segment of the population and play with the data if you want, but then finding the right dimension to use. But as also was said before, we really need to invest on this kind of basic data layer. And I see the integration there, because once you have this data layer, it's a bit more easier to work. I think that Stefan was highlighting the role of interoperability. Yes, it's there, but let's remember that interoperability is many things. It's technical, semantic, so forth and so on. And the patient on vision, the patient on one vision starts really from this kind of highly interoperable, real-time dynamic view. I don't know, Stefan, if you want to chime in as well.
I mean, if you take a look at the full picture, you know, it's not just about the technology. And for example, taking the experience of our national contact tracing app and making it interoperable, it required a legal framework change. It required a change in our privacy policy. It required a change in partial change in our data infrastructure and how the data flows. So there are all these different people working together. And it was only possible because all the stakeholders were aligned and were motivated to work on this. That's how it was really, really, truly impossible. None other way.
Absolutely. And Rajendra, maybe you had something to comment there on the policy-making angle of making these visions come through. Who should be the change agents, as Dipak asks us, to make these visions come through?
Yeah, Paulo, I think I would say that, you know, these debates are an important trigger point. I would confess and state very publicly, I have written policies. I have been a part of the National Health Policy of India, and the book that Stefan showed, I was among the 26 people who wrote the WHO's guideline for digital health. So I think, these forums trigger lot many thoughts. Look at the debate and the discussion Silvia and Stefan are having. I would, on the interoperability part, add one more element, that is human interoperability. Because at the end of the day, what happens is we can have semantic, we can have all types of interoperability. If the humans involved don't talk to each other with data, it doesn't make sense. So whereas I am a big champion of basic data before big data, I am also a champion of human interoperability before technical interoperability. So I keep saying, you know, you will read the book and you will find a chapter where I talk about healthcare technology. You will see that we have reached technical maturity. Stefan, Silvia, anyone can throw me a challenge saying, hey, look, this is a problem in health. And I'll say, hey, look, I have 10 solutions for you, 10 technical solutions. So technical maturity we have reached. Organization maturity we have still not reached. So you will find it tough for having organizations to adopt technology, but technical solution, dime a dozen. You know, it's not an issue. So I think it is simple when you envision and discuss, and when people like Stefan working on policy, or people like Silvia coming out reports, which we keep referring off and on. You know, we don't make policies in isolation. We go back to refer data of IDC, of, you know, Ipsos, anything that comes, because at the end of the day, healthcare is about clinical evidence. It's about data science. You know, if you cannot have those, I can't make a recommendation back home in my policy or in WHO. It's either low evidence or no evidence. At this point, it is low evidence. I hope we'll make it high evidence when we make policies in the future. My focus would be, let's boost the adoption of basic data in terms of EHRs, and also human interoperability, which is capacity building. I'm driving that at ISFTH, where I'm chairing the committee. And also we're doing a lot of work with WHO on capacity building. Happy to, Paulo, look at with you, you know, and discuss what should we do there.
Definitely. I think WHO is really an important guiding light, beam of light, you know, for the orientation at country level. And I see that Silvia presented the example of the NHS Digital, which is really an amazing example how they found out that the best vaccination strategy to get the least possible risk handled before the rest of the population that are not such a risk. So this is a clever use of data. And my question is, in India, are you in that level of proficiency in the use of the health data, Professor Rajendra? Because India right now is facing a major challenge. On that sense, a comment to you, and then to the rest of the panelists on how governments can make better use of data, health data.
So yes, Paulo, we have been very much, timely, and given that Indians are good at technology, so we actually created an app, the COVID app, the contact tracing app, in the very first wave of the pandemic. And I think it was when I wrote the book, it was 140 million people having used and downloaded, which has gone much beyond now. The entire vaccination strategy is online through the COVID application. You can schedule an appointment, get a digital. So you're probably the first one to have a digital certificate. You will not need a physical certificate. It'll come on your app. So I think, yes, we have extensively used technology, but is that enough? Probably not. I think we'll continue to innovate. And the government has Digital India, which is our flagship program. So we will leverage technology for health.
Fantastic. But it's good to hear that India is top-notch in terms of the use of digital data, digital health approach for COVID, fighting COVID. How about Stefan and Silvia? Your comments on the use of governments for better use of governments for health data?
I mean, I loved the word human interoperability. It really struck a chord. And you might have the best technologies in the world, and you might have everything available. But if humans don't agree between each other, for example, something as a feature like self-registration, if they decide not to agree on enabling self-registration, then you've got a problem. Both have to agree to enable this, and this happens. And I think what we need to start looking at, and this is why the European health data space is such an interesting proposition, because like this, we're bringing all the stakeholders on the table, and we're agreeing, saying, okay, we can deliver this specific data set, and we can share it with you. And once that step is taken, and once that commitment is done, then we can achieve so much more. But we really need to, now the COVID-19 pandemic has really brought out all these gaps, even the gaps in data and how they're moving. Maybe we need to also start thinking of data pipelines, public health data pipelines, where specific salient information needs to go from the member states or even countries around the world, which could centrally go to the WHO. We need to start looking at that if we want to act in real time to emergency situations, and especially something like this, possibly the COVID-19 pandemic. If the data flow was faster, we could have been in a much better position. Think about it. Imagine if the flow of data went much faster because of the available data infrastructure. Imagine how our response would have been. Now we really need to think about that.
Fantastic. And last but not least, Silvia.
And to pick to Stefan last comment, actually our research is exactly showing that those organizations, let's say local healthcare organizations that have already set up the prerequisite, not only on a technical point of view, but most importantly on an organizational point of view, of exchanging in healthcare information in real time, were those that were able to react faster to the pandemic, were those that were able to reallocate resources faster, were those that were kind of seeing what were the interventions that were working and what those that didn't work. So they were able to adapt to the changing situation. So I think that despite the consequences of the pandemic, we have a kind of a strong business case to move ahead toward a better data, I would say better governance, yes, of course, but it's more about the cooperation, it's about collaboration, it's about putting together some of the other, in the kind of a Paretian scenario, the 80-20 between technology and processes and people. Obviously, the processes and people takes the 80%, while the technology, yes, it's a tool, it's absolutely a tool, and it has the value when you use it well. Definitely, there is, I think also in the new recovery plans, I think that the public health is not highlighted enough. There is a lot of focus on empowering primary care, and it's all correct, don't get me wrong on that. But I think that we need a strong push toward national registries, and registries that are modern, not like 6-month-old kind of data, much more real time, because then you can have a real impact on and make sure that data deliver all the value that you want them to deliver.
Fantastic. So last closing round, what is the takeaway, the major takeaway from this conversation? I will start with Rajendra, then Stephen, last Silvia again, to conclude. Major takeaway that you would like to share with the viewers, with our audience right now.
So thank you, Paulo. I think fantastic discussion, a very actionable insights that come out. I would strongly follow that, public health should be given priority. In fact, I proposed a 4-tier model in the book on digital health, because now we have 3-tiered model: primary care, secondary care, tertiary care. I've added the 4th layer, which is the digital health, the digital public health. So I think this is the focus, and this is what you're doing, a human service to the entire fraternity. I hope the governments across the world will take note of that. Thank you.
Thank you so much, Rajendra. Stephen?
That we need to look beyond the technology, and we need to focus on humans. We need to focus on getting them on board and getting everyone on board and getting everyone aligned. Look what we managed to do with aligning all the stakeholders. We managed to move mountains, literally. So let's take this approach and continue involving and engaging our stakeholders, so that we enable data flows, so that we enable digital health systems, and we enable better health outcomes for everyone.
Thank
you so much, Stephen. Silvia, last but not least.
I would say all of the above, but definitely it will stay with me, Professor Gupta, interoperability of people. As Stefan also said, it's definitely the most important part, but really the focusing on the data, not just anymore as a system of record, but something that is actionable, something that gives you insights, something that gives engagement with the people that are on the ground, whether they are patient, whether they are clinical workforce.
Thank you so much, dear guest panelists. I couldn't have a better panel. Thank you also for Dipak for the video intervention, and over to you now, conference organizers. EHEALTH Summit stays on.